We are delighted to be back with you on this beautiful Monday morning after a gorgeous Kansas City weekend. Man, was that nice, Dana.
It was beautiful. Huh?
Yeah. So I'm joined on my right by Hawkeye. We're also joined today by Dr. Kenny Southwick, the Executive Director of the Cooperating School Districts of Greater Kansas City. He's going to update us on how reentry into school has been for the 31 member school districts. He's also going to show us a regional resource hub created by the Midwest Area Regional Council, known as MARC, designed to share data about COVID-19 cases. So, Hawk, the weekend seemed pretty steady. How are we this morning?
Yeah, I think it's still steady. 22 patients in the hospital. So we've gone up just a little bit from where we were. I think we got down to like 18 or 19 over the weekend. 4 of those are in the ICU, 1 of those on the ventilator. We still do have 35 people in-house that we are considering recovered. So that is still 50 beds in general.
Yeah, 50 to 60 beds that we are this has just been our number now for the last week or so. I mean, we got up a little bit high at the beginning, but then we've been really at the same level. So I think this is our equilibrium right now. And it's amazing. We say, oh gosh, it's only 50 or 60, and that seems better, but that's still, that is a lot with one diagnosis in the hospital. That's kind of crazy high, actually.
Yeah, and it is good that we only have 4 in the ICU and only 1 on the ventilator for sure. But again, that is still 50 people who really probably shouldn't otherwise be here.
Yeah.
Now, when they've come here, we found other things that maybe they had wanted evaluated or something like that. But they are,
they're here for
directly
coronavirus.
for that.
They're here because of COVID. They're not here because of the other things, and those other diseases may flare because of COVID, but they're not really here because of that. They came in because of COVID. And as we look down the road, it'll be interesting to see. I don't think we're going to know the effect of the Labor Day weekend, school reopening, and college reopening really until middle to late October, because it takes that second, third, fourth generation of spread, meaning a young person has it, and they give it to somebody else who gives it to a little older person, and then finally it works its way. And that's what we've seen before with these kind of events. It takes a while. And speaking of events, some more photos this week from not only KU, but from across the country of college campuses and watching college kids do what college kids do during pandemics, which is be a college kid.
Yeah, as it turns out, it's very difficult to tell younger age people to not congregate and gather and
in college,
enjoy each other. So that is kind of what we're seeing. Unfortunately, all of those pictures or videos, there were people just so close together.
Yeah.
And we know that proximity is one of the major risk factors for getting COVID-19.
Yeah, it is indeed. Well, Dr. Southwick, it is a delight to have you with us this morning. Welcome to our program, and thank you for being with us today. How are things going for the school reopening? Oh, we can't hear you yet, Dr. Southwick. Just one moment. Can you hear me? Yep. Okay, let's try again. Not yet. So in the meantime, hang on for just a minute. Let me go back to Hawkeye.
Yeah.
And we're gonna blather on for a minute. So over the weekend, I didn't see a lot about drug development, although there was an article in the New England Journal again saying, hey, here we go, the vaccine program is coming along. We know the AstraZeneca trial got restarted out in Europe, so at least in Britain, waiting to see when it might restart in the rest of Europe and the United States. But good news so far, because it's not unusual for a trial to be stopped and then restarted for different reasons. So I've still got my fingers crossed on the vaccine program. What do you think?
Yeah, I think it is good news that we have more than one. I mean, we have 10, 15 vaccine trials that are going on right now. So I think with that, there is a lot of funding from the companies in coordination with NIH and the government to really get this stuff done, get the trials done. But also, as we saw with the AstraZeneca, they did halt it. They did not have any qualms about halting it for safety reasons. And that's going to be the big thing moving forward, is getting that message out, continuing to say that message. These are vetted in a responsible manner. They're looking at safety. That is one of the biggest things. And then, of course, efficacy. So.
And I think that some data came out saying Moderna expects to release its trial results by the end of October, which is it's a big deal. So, all right, let's try Dr. Southwick again and welcome him back to our program, into our program, and see what updates we have for public school reopening, or school reopening in general.
Okay, I think we have technology figured out now.
We do.
Sorry
the tech is working.
So,
no, it's good.
Okay. Well, as of last week, all of our schools are back in session on the Missouri side. And as I've said before, many of those come with multiple plans in place, depending upon what happens. Number one right now is to keep our staff and our students safe and continue to be able to offer school in whatever alternative mode of instruction we need to. So we've had some school districts that have been able to open up face-to-face and all of their students in place. And the main reason for that is that they've had a number of their families that have elected to go virtual, which allows for that social distancing in the classroom. And so they're working the two sides of instruction. They're working in the in-house and that would be distance or remote. We also have some school districts that are employing the hybrid method. So students are coming in a couple of days a week and then they alternate. Maybe they do a little cleaning in between or at the end of the week. And then there's another group of students that comes in for a couple of days, and then they keep that rotation going. And whenever they're not in the classroom, then they're operating in a remote method. So it does allow for the education to continue. I've said also before, continue to say that our goal is to get all of our kids back in class with their teachers to figure out what that new normal is going to be. But as I listened to your all's conversation this morning about vaccines, listened to the news early this morning about different trials, and that we hope that potentially maybe in 9 months we might have a vaccine that we could get out to people. I'm sure it is this for the schools. It's a little bit confusing because we don't understand all that science, and we're going to rely on the help from professionals like yourself to tell us where to go and what to do. We have seen, and we're going to continue to see cases in our schools. We've had some athletic programs that have had to shut down temporarily with quarantine. We've had some classrooms and some teachers that had to shut down. I don't know any details about it, so I don't want to speak too deeply, but I do believe that Olathe lost a staff member related to complications from COVID. So our heart goes out to the families, their families, and to the school district as they deal with that. There's probably more of that to come, we know. One of the things that I would like to talk a little bit, I know you all were in conversation a little earlier. The cooperating school districts of Greater Kansas City, and I'll throw the Kauffman Foundation in there too, because they've been a great support for us, have worked to try to partner to support our school districts to help them with information that allows for them to make their decisions. On the Missouri side, as you know, it's more about local control. We aren't being told at the state level what actions we need to take in the schools. We're not being told sometimes even at the local level, but we are getting data. So it's been very difficult for school districts in this unprecedented situation we're in to make these decisions and make them right. But working with Mark, we put together a dashboard that's and there's an opportunity for anybody to get out there on that dashboard and see what's going on a daily, weekly basis in your school district, in the counties, in the cities. It will show you regional numbers, and you can make those comparisons. And this is some of the data that our school districts are using to help make their decisions as they flow from one program to another. Whether that be target date to bring everybody back or a target date to end virtual, to go to more of a hybrid, and then again go to full face-to-face, which is what our goal would be.
Yeah, it's man, these are hard times, right? We're trying to balance the health of the public, the mental health issues for kids. I mean, man, this is a difficult time. I do hope that 9 months is too long on the vaccine. I'm hopeful that it's just a matter of months, really. You know, we're in the middle of September now, and there have been some things. I remember Francis Collins, when we spoke with him, Dana, we were hearing that vaccines might be available as early as late October, early November, and really with 300 million doses ready by January. And we know that the government has already pre-purchased a lot of these doses and is ready and is building a distribution plan. So I'm hopeful that 9 months is too long, and maybe 9 months before we really complete vaccination. But
Yeah.
I'm optimistic. So, well, Jill, let's first start out with media questions and see what we might have this morning from media. Not hearing anything. I know we have questions from our listening audience today for ourselves and for Dr. Southwick. How's that going?
It's going great. Jarnay wants to know, what kinds of things should teachers be wearing or doing to stay healthy?
What can teachers wear or do to stay healthy? I don't know that, well, besides wearing a mask, Dana, I'm not sure there's a lot of wearing involved. Wearing a mask is the number one thing. But after that, it's going to be it's going to be the same rules of infection control that we would say to anybody, because really that's the story. You got to have a kid's mask, you got to be masked, then you got to wash your hands, you got to cough into your elbow, stay home if you're sick. Try to maintain distance as best you can. And I know that's a challenge for some of our schools with a lot of kids, but that still is really the right advice.
Yeah, I mean, it probably is a challenge, but after you do it for a couple days, a few days, a week, it should become like second nature. And we've talked about this since day one. We want to keep those adults in that school system healthy. We want to keep the teachers, the administrators, the counselors healthy. The things that you can do is wearing a mask. Wearing a mask all the time, when you are, especially if you're around people. Even if you are congregating and eating or have meetings, those masks have to be worn. You have to try to maintain as much physical distance from your other colleagues as possible, and that will keep you healthy. Eye protection, we've talked about that too. Eye protection can be worn. Sometimes it does get a little difficult. It does fog up. We've shown that. I know when I'm wearing my eye protection, when I'm in the hospital seeing patients, it will fog up sometimes. That's something I have to deal with. There are other ways to have anti-fog or defog your goggles as well, but certainly masks and then eye protection, if you can, is really going to keep you the safest in that environment. And that is for when you are around the children and when you are around your other colleagues as well.
Dr. Southwick, advice that you might have, just how easy is it, do you think, for teachers to maintain distance in schools and the classrooms? Because I know some classrooms are more full than others. How's that going to play out?
Well, a lot of the districts have tried to look at just raw square footage they have in their district and what can they do to spread out our students. What we can do as we navigate the hallways, a lot of lunches being served in the classroom, trying to keep the students in cohorts. One of the things I would tell you, I've not talked to a superintendent where masks haven't been non-negotiable. I mean, people are going to wear masks, and if they come into school, they're going to wear masks. In addition to that, one of our biggest challenges is probably the bus stops and getting on the buses. And one of the things that's helped us is a lot of our parents are driving our kids to school if they're in a situation where they have a vehicle available, or they might be able to pull together with other family members. So wearing masks is really important. One of the things that we've tried to emphasize too is that the adult to adult, you might go into a lunchroom with students, but a lot of those teachers have duty-free breaks. They go into the break room, and what we're trying to do is limit the number of teachers that we have in the break room. And that's actually advice that we got from your all staff as we visited early on. Protect the adults to children, but the adults to adult was a concern we had as well.
Yep. And just to say, that resource hub that you referenced can be found on preparemetrokc.org website. That's a pretty cool resource that you guys have put together.
Yeah, I've got to give Mark the credit for that. And there is a group that meets, and I've been serving on for the last couple of weeks. It's Metro area group that collaborate together to look at, in its mayors and its hospitals and its legislators, and trying to put all the data together. And they really have worked and worked to put that together. And it's the MAC group, the area MAC group that's done that. So have to give them the credit for that.
They've done good work.
Sydney wants to know, the staff member who passed, did they catch COVID at school?
Did the staff member who passed catch COVID at school?
I do not know any details of
I don't really know that either, and I probably would have to defer comment on that to learn a little bit more.
Okay. Claudia wants to...
actually is...
Dr. Southwick, did you have a comment?
Yeah, I did. One of the things I think that's important, and just like you all are regulated by HIPAA rules, the Family Education Rights and Privacy Act really does not allow for information to be shared when it can be identifiable to individuals, either individual students or classrooms. The data that you're probably going to get from schools would be individual data going to family, or would be information that might be school-wide, but not around a particular individual. So, and I don't have any information about the Olathe staff member either. So,
Claudia wants to know, how risky is it to pass people in parking lots or hallways or on the way to the doctors?
Yeah, that's a great question. If you're just passing through, we know that that's probably not a major risk. First of all, hopefully you're masked up, because that's the right answer. If you got a mask on and they've got a mask on, the risks are pretty minimal for a very short contact like that. And second of all, it's when you're outside, that minimizes it even more. And third, really we think that you've got to be in close contact with somebody for at least 5 to 10 minutes before you're going to have a real communication of the virus. Now, some people will say 15, but I think what it really depends upon is both intensity and duration. That is, the more viral particles you're shedding, then you probably, if you have a lot of viral particles, the shorter you can have a little shorter duration. If you have fewer viral particles, a little longer duration. And that really defines whether or not that disease is communicable. So it is a respirable disease, no question about it, but it's how long you're inside somebody else's breath cloud and their breath is hanging in the air.
Yeah, absolutely. I agree. It is the time. So just passing them in the halls. Now, we saw early on when the Georgia schools restarted, I believe it was Georgia, that there were the pictures of the masked kids in the halls. That's a little bit different. You're almost shoulder to shoulder. You are passing, but it is probably a little bit slower.
And you're inside. The breath clouds are all hanging out. You're going through a lot of virus at that point. If you have, even if you have 1% of the kids and you got, 100 people out there, at least one of them is going to be sick and in that hall, and there were probably a lot more than one.
But if you're passing them in the hallways, otherwise, if you're passing them in the parking lot, in the store aisles, just as you said, that's a very short amount of time. Even in the hospital, when I'm seeing patients on our COVID unit, there are times where I am done seeing a patient. I have to do my hand hygiene, remove my mask because I've been into a COVID patient room, remove the mask, throw it away, and then I go to the hand washing sink to wash my goggles and my hands. So I'm actually without a mask for 2 or 3 minutes while I'm doing that until I go back and get a new one. So even in that COVID unit where we know that there are COVID patients housed, I'm without a mask for 2 or 3 minutes. I'm not really passing too many people. Everybody else has a mask on, but the point of that is the duration that I'm unmasked, or the duration that I would be in a potentially harmful area is very short. So passing somebody in the hallways, passing somebody in the parking lot, that is a very short duration. That's probably going to be minimal to no risk at all.
Brandon wants to know if wearing a cloth mask over my surgical type mask is okay, or is it overkill?
Oh, cloth mask over a surgical mask, Dana. What are your thoughts about that?
Yeah, I don't think that's ever been studied. I would say that's probably not needed if it's a surgical mask. If it's a 2 to 3 layer cloth mask, you probably don't. You can have one or the other. I don't know that you necessarily need the double protection from that. Again, the masks are mostly to provide a barrier from you if you are infected and expressing virus throughout your breath cloud and when you're breathing and laughing. One or the other should be okay. I don't really think that 2 are needed.
Yeah, that's what I'm thinking as well. And indeed, you're going to still breathe in. Both of those are relatively loose-fitting compared to an N95 mask. So breathing in may be a little improved, but not by wearing 2. And the surgical mask should be better than the cloth mask in general anyway.
Yep.
Okay, Sarah has kind of a who wears it better question, but I think in this case she wants to know.
Hawkeye does. What else?
All the time.
Are the elementary students doing a better job of keeping their masks on, or are the older students?
Oh, that is a good question. I don't know. Dr. Southwick, what do you think?
I think the reports would be that the elementary kids are doing awesome and not having much trouble at all with that. The secondary kids probably are having a little more difficulty, and it's everybody around. It's other students, it's the teachers that kind of peer pressure. Put your mask back on, you got to keep it on. But I think that we're not anywhere like they are on the college campuses, but the older our teenagers get, the more they know. And so we have to do a little more due diligence with our masks. They also, last thing I'd say is the modeling out in the community is not real good. And that is, I was at Lowe's the other day, and more people had their masks down around their chins than they did over their face. They had masks on, but
no, they didn't really have it over a mucous membrane, is what you're saying.
Exactly right. So I just think it's going to come down to more community responsibility, more modeling, more holding everybody accountable. You all talked the other day about you not having any infections, and I went back to all our people and I said, if the hospitals can do it, we can do it. We have to be on top of it.
It is. I mean, it's a remarkable story of how hospitals have been able to stay safe once they got the appropriate PPE in, and we figured out a lot about the virus. It is funny, though, to think, gee, who would have guessed that an elementary kid is better at following instructions than a teenager? Shocker.
Right.
And college students, oh my gosh.
Yeah.
Now, the interesting thing is we've done some secret shopper work at the KU campus in Lawrence, and what we know is on-campus mask wearing is outstanding. It's like 99%. But it's kind of the after hours where things may not be quite as good, or off campus and the off campus housing that the challenge exists.
All right. Jamie wants to know, do you advise flying for work? And if one has to fly for work, what are the best precautions for me to take?
I'm going to be honest. I haven't gone back to flying yet. I've been driving anywhere. If you have to fly for work, I think there are ways that help you stay safe, Hawk. And you've done some of those when you flew. I've proposed that you clearly have to have a mask on. You got to have face goggles or some sort of face shield on to protect your eyes, and that you ought to make sure you wipe down your surfaces and everything around you. If I was going to fly today, I'd try to find an N95 mask to wear, because that would help protect me in terms of what I breathe in. Of course, it's got to be fit tested and have a lot of things to go right with that to make sure it really works. But I like the idea of having some protection for what I breathe in as opposed to a standard surgical mask. But I don't know that that's a staunch requirement. What do you think?
Yeah, I was supposed to fly here recently, but I canceled. I don't know that I've settled back on flying since early June. My personal preference is I would, if I had to go anywhere, I would just drive as well. So I think right now it can be a dangerous proposition, but there are ways that you can protect yourself as well. Again, this is not airborne like the traditional infections, measles, tuberculosis. If this were just my surgical mask in the hospital, would probably not have provided me protection, and I would have been infected already.
That's a true airborne disease,
right,
as opposed to droplets.
And it can just hang in the air for hours. And like I said, I've walked through the unit when I'm taking off my PPE to put on new PPE without any mask on. So, but that being said, the cloth face mask or the surgical face mask should be enough to provide you protection if everybody is doing it, acting as a barrier, and also provide you some protection. If you have to fly, I would certainly recommend the eye protection as well. And again, while you're not in the plane itself, if you are just waiting in line or waiting at the airport, try to maintain your space from other people as well. And also, obviously, use good hand hygiene. So it's the same things that need to be done over and over, whether it's the workspace or whether it's the airport.
And just to say, and I'm going to come back to that question that was asked earlier that I don't think we ever answered, about clothing. There are certain types of clothing to wear, and whether you're a school teacher or you're on the airplane, that question could apply. Are there certain things you should or shouldn't wear? And the one thing that we haven't gone back to doing, Dana, is we haven't started wearing ties again. Mm-hmm. And I keep wondering, if we've been saying surfaces aren't as much of a concern, but when your tie is constantly brushing up against surface and you're constantly touching it, it makes me still feel a little uneasy yet to do ties. Hopefully they'll be back before too much longer. Mm-hmm. I would say the same thing in the airplane, that you probably don't want clothing that's going to kind of go brush up against everything else and then brush up against you outside of your standard, shirt and pants or whatever.
Yeah, I think that just doing that, even again, the virus so much dropping to the floor and on your shoes or on your pants or anything of that nature probably isn't going to pose as much of a harm as just more being around people, especially if they are unmasked.
Yeah, it's the masking that makes it different. Dr. Southwick, have you had to do any flying?
I don't like to fly when it's normal time, so no, I'm not flying. I have a son that lives in Los Angeles, and we generally drive.
Yeah, well, that's a long drive, too.
That is a long drive.
Yeah, it's a long time in the airplane, too.
Yeah, it is. There you go. All right.
Michael asks, if I wear the same mask all day and I walk by many people for short durations, does the breath COVID cloud accumulate on my mask?
Well, that's a really good question. Does it accumulate on the mask? And it can. So, again, the key is that it can still be a barrier. But remember, your mask is protecting others more than you. It may protect a little bit around you. But the key is when you take that mask on and off day, you got to do good hand hygiene before and after touching that mask.
Yeah, absolutely. And, I don't know if the question is centering on with the respiratory droplets and the heat and the moisture that you're breathing out, if that has anything to do with it. We've always advocated for not using wet masks. So certainly if it's raining and you're outside and your mask get wet, or if you're exercising and you're outside or even inside and it gets all sweaty and wet, that's one thing. So I don't know if he's trying to center on that question. Certainly we want to make sure that the mask maintains.
I bet it's more of I'm wearing
dry.
all day long and I keep going by people and maybe I'm getting into their breath cloud. But
Yeah.
if other folks have their mask on, you have your mask on again, you're probably safe. And it's once your mask gets wet. Which comes back to that question, should somebody put a cloth mask over a surgical mask? And I'm going to go back. I'm actually going to take a bigger stand. I'm going to say no, because I think you may defeat some of the properties of the surgical mask by wearing a cloth mask over it. And one of it may be the trapping of humidity to make the surgical mask wet, or at least damp. And once things get damp, the material starts to stretch or pull apart a little bit, and then you become a little less protective. So I'm going to go in a stronger stand and say no to that.
Yeah, and even when you're just walking through somebody, we've seen these articles that show that the virus can go from one room to another or something of that nature when they're doing air sampling. But if you look at those results, actually, the concentration, the amount of virus in 1 liter of air is so small that just walking through and doing that, you're not really going to contaminate your mask with the virus for any significant time or any significant concentration if you're wearing it all day and walking through.
This may be a good time to ask a question that Andrea and Angela and others are asking. They want to know if you read the New England Journal of Medicine article that says wearing a mask may provide some immunity.
Yeah, we talked about that last week, that you're getting low levels of, and it's more speculation. It's not known yet. Let's be clear that that's not science. That's just that's people theorizing, not proving yet. That wearing a mask may introduce you to lower levels of the COVID virus the coronavirus, because you're not coming into a full amount of contact because the mask filters out some of it, and you still breathe in a little bit of it. Not enough to push you across that threshold of infection. Remember, it's both intensity and duration that really produce how sick you become, we think. And so if you get a smaller amount of virus, that's a lower intensity. And it may actually lead to some immunity because you're getting repeated exposure to it. That was a hot report last week. I think it was coming out of the UK. I want us to be careful with that because it's not known. However, because it's going to support mask wearing, I'm going to support it.
Yeah,
I like the idea.
I think it's good. I think it's an interesting, theory to understand. If it does, that's good. Again, the theory is that you are getting such a low dose, and it is able to get into your respiratory tract, and your cells are able to take it up. Once your body takes up that infection, then it starts to go into the immune system process, where now your cells are starting to show the viral protein so that your immune system can react to it. You're starting to have viral replication. It's certainly an interesting theory. And we've also talked about before how maybe the infectious dose or the viral load that you come into contact with, the intensity, can maybe lead to further severe illness as well. So it's a lot of good theory. I think we continue to watch it, monitor it, and it is one more reason then to wear masks.
Dr. Southwick, as you guys thought about mask wearing and opening schools and things like that, I'm going to bet you probably had some parents out there saying, "How dare you open schools?" and others saying, "How dare you don't open schools?" How did you balance that?
Well, it's a pretty tough time to be a school board member and a superintendent and a staff member in schools. one of our superintendents to the north in our group said, "Here's my dilemma. I can't make a decision that's right because half of the people in my community think that COVID-19 is a head cold, and the other half think it's the plague. And there doesn't seem to be anything in the middle." So we actually all through the summer had these discussions, and seemed like about every other week there was another issue where there seemed to be community pushback. These people have made the very best decisions that they can make to provide a high quality education, knowing that there will be mistakes, there will be outbreaks, there will be quarantines, there'll be isolations, but the school is extremely important for our students and for our community. So it's just kind of where we are. There was a period of time in the summertime we thought, there's no way our communities are going to let us wear masks. I think you guys have helped in that, continuing to preach that this is one of the major defenses. And now masks aren't an issue in school. It's a given. You're going to wear them, and if you're in and around an activity, and if not, and if you refuse, you will be asked to leave. And that's the stance that our school systems have taken. So, but very, very, very tough decisions that we're making. And this is my 45th year being involved in public ed, and I've never been experienced anything like what we're going through right now in terms of decision making.
Yeah, I think this is really hard. I have sometimes referred on this program to others. In fact, I was talking to one of my colleagues yesterday, and we were both about the same age and remember what the AIDS epidemic was like, and that was also a really, really hard time. But it didn't have some of the larger questions around education as involved, because kids can be safe. There were some, because if a kid came to school who was a hemophiliac or whatever, and then nobody wanted to be in that school because he might have AIDS, I mean, there was some of that, but it wasn't to the level of what we're seeing in today's educational program. And so I think this has been a special challenge to schools and to much of our fabric of society.
Tracy has 2 children, both under age 8. Every day they come home with wet masks. She's wanting to know what the consequences will be to my children doing this 5 days a week.
Yeah, wet masks and coming home with that. And I'm going to bet those are cloth masks that get wet because they've been in school all day long. They've been breathing out and washing their face, doing whatever. And actually 8-year-olds don't wash their faces, so they were doing something else.
You know, I don't know if there's going to be long-term consequences. We know, and we've seen reports early on about masks causing skin irritation. I would just keep an eye on their skin and their face and the area that's covered by the mask to make sure there's not a lot of irritation and rash. The other thing you could do is maybe have them bring 1 or 2 or 3 masks to school and change it out at lunchtime and go
during the day. Yeah. That would be smart, I think. And then the other thing I would just say is, if you're worried about increased risk of infection, that's true. But again, masks are more protecting everybody else, especially cloth masks, not as much protecting you. And a cloth mask can still have some barrier protection from things going on. It's not as great as when it's dry, but they'll have some protection even still when it's wet. And it depends on how wet it is and what kind of fabric it's made from. By the way, the more layers in that mask, the better. You know, there's been some data out there that says the single-ply masks are not so good, like the kind of the gaiters. But if you get a 2 or 3-ply one, then those work great.
Yeah.
Ann wants to know if you can wash a surgical mask.
Can you wash a surgical mask? I think that's probably a bad idea.
Yeah, I would say
that
no
would
on
defeat
that.
the way the thing is built.
They would break down pretty quickly in the washing machine.
Yeah, I break mine down
hand
during the day because I tend to pull and yank on it or get it wet.
To Dr. Southwick's point earlier when he was talking about 9 months for a vaccine, Robbie wants to know if children and young adults are at very low risk for serious complications, will they even get the vaccine?
Well, that's a great question. It's a great question. And so, you know, vaccines do a couple of things. One thing is that it protects you from getting sick, and we know that anybody can get sick, and we know that there are, you know, about 7,000 people under the age of 30, I think is the number or thereabouts, who have passed away from COVID-19. So and another 7,000 or so who have been have entered into some rehab facilities for physical rehab because of the effects of the virus on their strength or on their lungs or on their heart. So I would say to you that everybody's really at risk. The second thing I would say is that vaccines have another mission. And the other mission is they help to prevent transmission of the disease, because if you've had the vaccine and you can still get infected, but the infection tends to be at a much lower level and you don't shed as much virus, and so you're going to be much less likely to spread the infection. So a second reason to make sure you get a vaccine, Dana, is to help you from becoming a spreader.
Yeah, absolutely.
Pretty good for a pulmonary guy to the ID guy. I'm just handing that
No,
off.
I think that's good. I
Not
think
bad.
it is for to prevent disease or further in that spectrum, severe disease and hospitalization. Because to your point, even young people can have severe consequences. I think it was almost up to 3% that went into the critical care ICU or died of those young people. So preventing disease, but also to your second point is preventing the spread, and certainly the vaccines will hopefully prevent the spread of the disease as well.
Yeah.
But I don't think that we have to see what the algorithms are for when the vaccines first come out, who is going to be recommended to get those
Right.
vaccines.
It looks like there's
in the
four.
first.
We're trying to bring some folks back on the program to help us with that, to have this discussion with the public. So I think that's a really important discussion.
Vicki wants to know how safe it is for her grandkids to come and visit. They go to school every day.
Last question. Here we go. Is it safe for kids to come and visit their grandparents if they're going to school every day? Man, I think that goes back to our question. It's a great question about how much risk you're willing to take and what kind of visit is it going to be. Are you going to be outside? Are you going to be distanced? Are you going to have your masks on or not? That's really probably the key part of that. If you're just going to come and have your kids come and visit and give a big hug, and let's say you're 65 or 70 years old and you've got some health concerns and the kids are around, they're going to be around a lot of sick kids, other sick kids, I think I'd have to be a little careful with that. But there's no right answer or wrong answer here. This is back to how much risk are you willing to bring in to your bubble. And what I would say to you is, if you feel like you want to do it and that's really important to your mental health and you've got to do it, then okay, but know that you're going to take on more risk. And I think that's it, unless you can be outside socially distanced.
Yeah, I think if you can do that, we know that secondary infection rates or attack rates within households can be 15 to 30%. That's really kind of where we've landed now with all of the secondary attack rate research that's going on, looking at household contacts and things of that nature. So if you can reduce your risk as much as possible because you want to see your loved ones, then you do have to take those other steps. If you can be outdoors, that's better. Try to continue to be separated from them. 6 feet is good, but certainly 8 to 10 feet. If you can do that, that's better, especially if you're indoors. You really may consider wearing masks indoors as well while you're visiting with the children and while you're in that household. Certainly I don't think there's anything wrong with giving a hug or squeezing them tight, when you get there and before you leave. That's a very short interaction, but taking those other things into consideration is probably safe.
Well, listen, as we wrap up today, Dr. Southwick, final thoughts that you might have around the school reopening process, how it's going, and how well parents and kids are cooperating.
Yeah, I just want to thank all those people that have had to make tough decisions, and that's all the way from the administrators and the boards and parents who have decided which method of instruction they want their kids to be involved in right now. I think things are going as well as we could expect them to. I think we're going to come into a little bit of a mean season. You all talked about that. We have to be ready for that and how we'll pivot when we need to. My last comment would be this, and I can't even tell you who coined this, but in terms of taking care of our kids mentally, and if we can begin to talk about, we're going to social, not necessarily social distance, but we're going to physical distance and keep ourselves physically apart, but we're social beings. We've got to figure out a way that we can make up that space, but still have all the important connections to our children and our grandparents and our neighbors and everybody else, because we're social beings. So if we can physical distance and put the emphasis on that, but keep everything going socially as much as we can, I think that'll help us be mentally stronger and get through this.
Yeah, I think that makes sense,
Yeah,
Hawk.
absolutely. Yeah, we do want to be with our loved ones and with our friends and our family and doing things, watching Chiefs game, being at the Kauffman, being at Arrowhead, doing all that stuff. We just have to do it a little bit differently now, and hopefully we will get back to being able to do it the way we wanted to do and celebrate the way we celebrated the Chiefs winning the Super Bowl when we were all probably at house parties or at the bars or wherever, watching it with other people, even people we don't know, because humans are social beings, and right now we can't do that in the same manner that we did. But moving forward, eventually we hopefully can get back to that.
Yeah, I think that's right. Hey, tomorrow, Joe Reardon, who's the president and CEO of the Greater Kansas City Chamber of Commerce, is back with a call to action for our community, following the recent update that the chamber had with chief medical officers as well as community leaders before the Labor Day weekend. We are also continuing to compile our list of 50 reasons to love your mask. Now, don't forget about that. We want to send you your mask photos, but don't forget to tell us why you love your mask. We're halfway to 50. I can come up with a bunch of them myself, but if you get to 40, I'll give you the other 10. I promise you, I can come up with 10 reasons to love your mask. I bet I can come up with 50, but I'd rather have your 50 as opposed to my 50, because my 50 would include references to Star Trek and John Denver. Hey, here's a photo. This is Becky Williams. She's one of our clinical nurses who cares for COVID-19 patients. She paused for this photo to say thank you for the pizzas purchased by a grateful family who wanted to feed the unit. There's also a cookie exchange going on between hospitals. Here's Dominic, Jessica, Taylor, Katie, Maddie, and Emily. They received some cookies from one set of folks, and now they're sending them to St. Luke's in return. They can stand close to each other because, note, they got a whole bunch of PPE going on. They got the Pappers going on. So, Hey, listen, thanks again to Dr. Southwick for being on our program today. Hawkeye, welcome back. It's been a great weekend, beautiful weather. It's going to continue to be a beautiful week this week. And it's going to continue to be a beautiful fall. And it'll be made even better if we stay healthy and take care of each other. Because, at the end of the day, we got to get through it together. And then we'll be able to have a lot more fun on the other side. So in the meantime, remember, there's still no place like home. We'll see you tomorrow.